Every single day, patients walk in the hospital expecting safety. They believe their chart is accurate, their medications are correct, their symptoms are being taken seriously, and someone is carefully watching every detail. But what if I told you that some of the deadliest hospital mistakes happen quietly? A missed symptom, a medication error, a delayed diagnosis, a rush diagnosis, a doctor who never read the full chart, or a nurse who never updated during shift change. And sometimes those mistakes cost people their lives. So today we're talking about the hospital mistakes every patient and every family member must understand before the next medical emergency happens. Because the truth is this: being passive inside the healthcare system can be dangerous. And the patients who know how to advocate for themselves are often the ones who catch problems before they become tragedies.
Welcome to the walkthrough.
And if you believe that patients deserve safer healthcare and stronger medical transparency, hit that like and subscribe and turn on notifications. So let's get into it, shall we? Most people assume that hospitals are perfectly coordinated environments, but the reality is much more complicated. Hospitals are often understaffed or overloaded, fast-paced, and emotionally intense. They also are operating under constant pressure. Even great healthcare professionals can make mistakes in a broken system. And unfortunately, patients are the ones who suffer when communication fails. Hospital errors include wrong medications, missed allergies, incorrect chart information, delayed treatment, or overlooked symptoms. Also, surgical mistakes, infections, and dangerous discharge decisions. So let's be clear. This is not about blaming or attacking doctors or nurses or hospitals. There are incredible healthcare workers saving lives every day. This is about understanding one important truth. Patients cannot afford to assume everything is automatically correct. That's why patient advocacy matters, because informed patients ask questions. Informed patients verify information, and informed patients speak up when something feels wrong. And sometimes that makes all the difference. If you want to learn how to protect yourself during hospital visits, doctor appointments, or emergency situations and medical confusion, make sure you grab my ebook, The Patient Protection Blueprint, linked below. Inside, I break down how to ask the right medical questions, how to spot red flags, how to communicate with doctors effectively, and also how to protect yourself from preventable healthcare mistakes. One of the most common and dangerous hospital mistakes involves medication errors. This includes receiving the wrong medication or having the right medication but receiving the wrong dosage. It also involves medications interacting dangerously, allergies being overlooked, or taking duplicate medications, or medications being delayed entirely. And here's the scary part. Patients are often too overwhelmed, medicated, or exhausted, or intimidated to question what they're being given. Never assume every medication handed to you is automatically correct. Always ask questions such as, what is this medication? What is this medication for? And what are the side effects of this medication? Also ask, is this safe with my current medications? Has this been checked against my allergies? And if something looks unfamiliar, speak up. One simple sentence could save your life. Before I take this, can we double check what this medication's for? That is not being difficult, that is being safe, especially if you have multiple doctors, if you have a chronic illness or illnesses, if you had a recent surgery or are taking several medications already. Medication safety requires your involvement as a patient. One of the most dangerous experiences patients face is not being believed. Too many people hear, you're probably just stressed, or your labs are normal, or it's anxiety, or you're overthinking it, or that's common. Meanwhile, something serious is actually happening. And sadly, certain groups are more likely to have their symptoms minimized, such as Black patients, women, elderly patients, chronic illness patients, and people with invisible illnesses. This is why trusting your instincts matters. If your pain suddenly worsens, say something. If your breathing changes, say something. If you feel like your condition is getting worse despite treatment, you have to say something. Never let fear stop you from advocating for your health. Some powerful phrases include, I'm concerned because this feels different. Or can we rule out anything dangerous? Maybe you could say, I would like this documented in my chart. Can I get another evaluation? I don't feel comfortable ignoring these symptoms. See, these statements create accountability. And remember this, you know your body better than anyone else. One of the biggest hidden dangers inside hospitals is what's called poor communication between medical staff and medical doctors. Patients often assume that every doctor is updated or that every nurse knows the latest plan. They assume that every specialist reviewed the chart, and they assume that every test result has been discussed. But communication breakdowns happen constantly, especially when there are things such as shift changes. If there are other medical emergencies on that same floor, if there are staff shortages, or if there are department transfers or in between overnight care. And when communication fails, dangerous mistakes increase. This is why keeping your own notes is critical. So track your medications, track your symptoms, test results, procedures, write down your provider names, and write down instructions. Do not rely completely on memory when you're in stressful medical situations. Also bring an advocate whenever possible, like a trusted family member, a spouse, a friend. They may notice things like missing information, inconsistencies in your care, medication confusion, or they may notice worsening symptoms before anyone else does. Another hospital mistake patients need to understand is what's called premature discharge. Some patients leave the hospital still confused, still symptomatic, or without fully understanding what comes next. And once patients leave, serious complications can escalate quickly. So before you are discharged, ask some questions. What symptoms should concern me? When should I come back immediately? And what side effects should I monitor? Who and when do I call if something worsens? And can you explain my medications clearly? Can you explain this in simpler language? Do not pretend you understand instructions if you don't. There's nothing embarrassing about asking for clarification. Confusion after discharge can become life-threatening, especially if you've had an infection, or if you had a blood clot, if you had breathing complications, or if you had medication errors or surgically recovering problems. Clear communication will save your life. Another dangerous issue patients rarely think about is overlooked test results. Many patients assume if something is wrong, someone will call me. But sometimes abnormal results or abnormal labs get missed. Imaging results are delayed or follow-ups fall through, or sometimes providers assume someone else already handled it. This is why patients must actively follow up. You should never assume silence means everything is normal, because it doesn't. You should be asking questions such as, what were my results? Can I access my medical records? When should I expect follow-up from you? Who reviews my results? And if something feels unresolved, keep asking questions, because persistence is not paranoia. Persistence is protection. So let's take a quick pause for a second. And I want to say this. If you're realizing how important patient advocacy really is, this is exactly why I created my ebook, The Patient Protection Blueprint. Because most people are never taught how to navigate hospitals. They're not taught how to communicate with doctors, nor are they taught how to recognize medical red flags, or they're not taught how to protect themselves from preventable healthcare mistakes. My ebook gives you practical, real-world strategies to become a stronger advocate for yourself and your family during medical situations. If you want to feel more confident before your next hospital visit or your next doctor's appointment, Grab your copy using the link below. And if this video is helping you, I want you to hit the like and subscribe button because more people need this information than ever before. So let's continue. Let's talk about your support network. Family members often notice dangerous changes before your medical staff will. They may see things like your confusion or your personality changes. They may see worsening breathing or severe fatigue, unusual behavior, or physical decline. If you are advocating for someone else, do not ignore your observations. Use clear, specific language. Let me give you an example. So instead of saying something seems wrong, rephrase it and say it this way. This behavior is new. Or this is a major change from earlier. Or I'm concerned about rapid decline. Or can someone reassess them immediately? See, specific communication gets more attention. And remember this, advocating for someone's safety is not being dramatic. It's being responsible because you love them. Here are some of the most important ways to reduce your risk during hospital care. Number 1, bring an advocate. A second set of eyes and ears matters. Number 2, verify every medication. Ask what it is and why you need it. Number 3, keep your own records. Track your symptoms, your medications, your allergies, and your procedures. And number 4, speak up early. Do not wait until symptoms become severe. And number 5, ask questions repeatedly. Clarity matters more than embarrassment. Number 6, trust your instincts. If something feels wrong, investigate it. The goal is not fear, the goal is awareness because informed patients are safer patients. At the end of the day, hospitals are run by human beings, and human beings, even good people, can make mistakes. That is why patient advocacy matters so much, because your willingness to ask questions, to verify information, to speak up and stay informed could literally save your life or save your loved one's life. I'm glad you gave us a few minutes. If this video has helped you, share it with someone. Share it with your family and with your friends. Someone you care about may need this information before their next medical emergency. If you want to become a stronger, smarter advocate inside the healthcare system, make sure you grab my ebook, The Patient Protection Blueprint, link below. It was created to help patients be able to protect themselves. It was created to help you communicate effectively and to recognize warning signs and to navigate healthcare with confidence. Also, don't forget to hit the like and subscribe button and turn on your notifications for more content about patient rights, medical mistakes, hospital safety, healthcare advocacy, and protecting yourself inside the medical system. Remember this, it's important. The most important patient is an informed patient, and your voice inside the healthcare system matters more than you think. So again, hit the like and subscribe button below. If you want to reach us, you can reach us at self-advocate. I can't remember, but I have my email in the description below. I know it's selfadvocate247 at thewalkthrough.org. Also, you can reach us on, excuse me for hitting my nose. You can reach us on our Instagram page at thewalkthrough.org. And then you also can reach us at our website, which is thewalkthrough.org. So I'm hoping this was a blessing to you. And I'm interested, if you have a comment or you have an example or a real life scenario or experience where you were in a hospital and maybe you caught something that you didn't expect to catch. Maybe there was a mistake that was overlooked that could have cost you dearly or a loved one dearly. I would love to hear about it in your comments below. Hopefully we can form a community where we help each other in advocating for our medical care. And again, if you have any questions, if you have any needs, you can reach us on our website. You can reach us on our Instagram page, or you can reach us by email at selfadvocate247 at thewalkthrough.org. Blessings.